I would just say in general, it's been a challenge for doctors and for families, because sometimes you really want to use amoxicillin and you just have to use something different. Or, if someone's allergic to what you might otherwise have used. So for example, a backup medicine or an alternative medicine that we use a lot in pediatrics is ceftonir. And if a patient has an allergy to that, well, that's kind of my go-to alternative. So what do I have to use instead? So sometimes we just have to get creative. I would say, I don't know of anyone who hasn't been able to get an antibiotic that will work. It's just been maybe a day later as we try to work through these issues. Okay, let me send a new prescription. Oh, they don't have that. Then they communicate back to us. So we got to send something else. So it's just been a communication challenge, and finding something for that patient sometimes takes some time. Honestly, hoping that things calm down a little bit. RSV really peaked in October and seemed to kind of taper off towards the middle of November. So that, that's been calming down now. Flu has really been all of November, starting to calm down, which is nice. And COVID hasn't been too bad in the last couple months. So I think in general, the respiratory stuff is calming down. My fear is that COVID is going to spike in the new year, January or February. But I think kids being out of school is going to help more than it's going to be hurting. Granted, a lot of people travel, a lot of people get together with families. Anytime you get people around people, you're going to mix some viruses, and there's going to be some exchange of that. But I think the overall, I anticipate that things will be a little calmer for the first few weeks of February.